Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. So the next thing I was hoping we can talk about to folks is making sure we really iron out that cancer staging. Because I think when we talk about what is cancer, hopefully we've done a good job explaining that cancer is really a description of a part of the body that grows uncontrollably. Cancers can occur anywhere, and each organ and each specific individual's type of cancer is going to be its own unique disease, essentially. But the staging is pretty similar from patient to patient within a given cancer type. So lung cancers are staged similarly, but differently from kidney cancers, kind of thing. And most of the cancer staging that I'll be talking about is solid tumors. For patients who have leukemias, lymphomas, things like that, this staging nomenclature doesn't apply the same. So one would have to talk to their doctor because those can get kind of complicated. But for most solid tumors, when we talk about an early stage cancer, a stage 1, those are cancers that are small and haven't yet spread to the rest of the body. This would be something like a lung nodule that was identified on a CAT scan, and it's small, it's a centimeter. Those would be a stage 1 cancer if it hadn't spread anywhere. Generally speaking, those are things we try to cure. We'll try to cut that out, we'll try to radiate it, and you may or may not, a patient may or may not have other therapies. And that's generally true for the other solid tumors too. Stage 1 is small, and we're usually able to get rid of those without things like chemo. But that's not always true, but that's the paradigm. Stage 2 and 3 mean that these have spread or they're much larger. So this could be, stage 2 would be a tumor that's larger, maybe it's spread locally. Stage 3 could be a tumor that's larger and it's spread a little further locally. And when I say locally, I mean to the surrounding lymph nodes usually. And then when we get to stage 4, that's when things have spread to the rest of the body, somewhere not in the surrounding area. Stage 2 and 3, we often will try to cure. And these are usually tumors that are going to have combinations of surgery or radiation, some type of therapy that goes to the rest of the body, commonly chemotherapy. And the goal is still for a cure for many of these stages. When we get to stage 4, rarely the expectation is cure. Most often, the expectation is to treat. And those terms can be confusing. That's the vernacular we started using in oncology a long time ago, where we'll say we might not be able to cure your cancer, but we'll treat it. And what that means is imagining your cancer being like a weed, it has spread seeds out to the rest of the body, often through the bloodstream. And those seeds have planted in different areas. And with the techniques we have now, we're unable to see them because they're so small, and we're unable to go and cut them all out. So we use chemotherapy or, sometimes pills that can go everywhere in the body. And those we think of kind of like weed killer. Sometimes, if it's only spread a little bit, and we're pretty confident about that, we will still try curative strategies. So those are definitely things to talk to your care team about if this applies to you. But generally speaking, stage 4 is what we call metastatic or incurable disease. Was that pretty clear, Samantha?
Yeah, that was super helpful. My reaction to that, especially as we're talking about what is cancer, so stage 1 through 3, specifically, we talk about what is cancer being cells that divide wrong or something that's gone wrong, why does treating it or just removing it when it's at stage 1 mean that the body isn't going to continue to do that exact thing? Like, what interrupts that from just continuing on?
Do you mean like another cancer forming?
Yeah, I mean, because the way we say, like, what is cancer, right? Like, something went wrong when you're removing something or giving it treatment. Who says that once those things are taken out and you no longer have cancer in your body, that those things are still not going wrong?
Often they are.
Yeah.
Patients who have one cancer are often at higher risk for developing another cancer.
Okay.
So you're right. A lot of times we don't know what the process is that makes them high risk. But generally speaking, in medicine, one of the biggest risk factors for something happening is it had happened before. Someone
Right.
having one heart attack means they're at higher risk for other heart attacks, strokes, they're at higher risk for strokes, those kinds of things. And cancer is no different. We, I think we've understood the tip of the iceberg with cancer.
Yeah.
We understand many of the things that can cause it, not all the things. And we don't understand what caused those errors in a lot of cases. A lot of times when one will see an oncologist will say, we chalk it up to bad luck. And but bad luck means we don't understand it.
Yeah. Yeah.
Like that's what that means.
That's
Is
helpful. That's helpful to know, because the amount of times I've been told, it's just bad luck that you got this. And I'm like, okay, but what does that really mean?
right. That's what that means, is we don't know.
Right.
Um, we know how errors can happen. We have some understanding of what can lead to this, but we don't know what happened in a given individual. We don't know what certain cancers run in families and we don't know why. There's no
Yeah.
like family syndrome. We just know that cancer gets a lot of families, or that
Yeah.
family has a lot of cancers. So there's a lot we don't know
Yeah.
in terms of what causes cancer and therefore what it is to have a cancer.
Mm-hmm.
But beyond the biologic definition, and this is, in my mind, it's like, if you want to know what something is, like, let's say you want to go to a dealership and a car dealership, and you want to talk about a car you're interested in because you're the one that's going to experience that car, you're going to drive it. You can talk to the engineer that constructed the engine, but that's probably not going to be a lot of the information that's going to be useful to you driving it. Like, you want to talk to other people who have experienced that experience. So, I'm curious, Samantha, when we're talking about what is cancer,
Mm-hmm.
there's a social answer too. There's not just a biologic answer. And for the most people listening, the biologic answer is not going to be the answer that matters most in their life, although it's important to know, I think. So what is cancer to you socially? How has it changed your life? What has it meant for you?
I mean, we could do a 5-hour podcast on how it's changed my life, but in terms of like what is cancer and what that meant for me in terms of like the emotional piece of it, is that I immediately wanted to find other individuals like myself so that I could have that level of camaraderie, understanding from individuals that were going through the same things as me. And I found a couple groups that were extremely helpful to me, where one in particular was an expert in my very specific mutation. So individuals of all ages are part of this group and can talk to each other, talked about different drugs that they were on, different experiences, etc. And the other group is one where individuals under 50 years old come together and talk about their experiences with lung cancer and what it's like and the trials and tribulations of it. And within that group, there's, I want to say, about 10 of us with HER2 because it being so rare. And having those individuals and being able to relate to them and talk about my experiences, their experiences, meant so much to have that. I guess the friendships we never wanted to have, but now I'm very grateful for them, and I do count them all as my friends. And I would say to people that, you know, when you're learning about your cancer, you're being told you have cancer, finding individuals that have your type of cancer. And if you happen to have a mutation that is targetable, finding those individuals too, because it definitely changes your experience. And I have 2 or 3 in particular ladies that I speak to probably every other day, and we're just venting or crying or being angry or just talking about how we're feeling. And it helps so much. And having that connection is invaluable, because, you know, I have connections in the lung cancer space where people don't have my mutation, and obviously I count them as my friends too. We talk about everything I talk to about the people that have my mutation, but there is that level of connection with individuals that have exactly the same cancer as you. And ironically, you know, you and I joked about me drilling down so far in the things I didn't want to know. You know, I look at the molecular biology of some of these other individuals because they share their profiling with me. And I have found another individual, a gentleman, who has exactly the same breakdown as me at the molecular level. And so I really watch, because he's ahead of me, like, how's he doing on treatment and how's he responding? And while that seems so silly because we're all different, or we're all going to respond differently, having the knowledge that this individual is so similar to me just gives me a really strange connection with this person that I never wanted to have. But that was my initial, like, when I was learning about cancer and that I had cancer, of how to find and seek out those individuals so I could have those relationships and be able to relate to our experiences. It was critical for me.
Well, and what I hear when you say that is, first getting this diagnosis was isolating. And this is, you know, how you navigate that isolation. Because, you know, in your community, people around you, I imagine, one, having cancer at all is pretty isolating. And then when you have one of these unique types of cancer, probably even more isolating. Was that the feeling?
Oh, 100%. So when I was diagnosed, for the audience, I lived in Missoula, Montana, population of about 70,000 people. And so when I was diagnosed, I felt so alone. Like, am I the only young person in the entire town that I live in that has cancer, let alone like a lung cancer? And when I had my first oncology appointment, the oncologist actually mentioned that the day before he had had someone under 50 with very similar symptoms to me and was also diagnosed with lung cancer. And I wanted to say, will you put me in touch with him? But I know, due to patient confidentiality, you know, oncologists can't necessarily do that. They can't mention names and all of that. So I was grasping at, oh my goodness, there's someone in this town that happens to be literally at the same time going through the same experience as me. I need that. But obviously that wasn't possible. So going online and trying to find these groups was the next best thing. And that's where I kind of found my, I like to call it my tribe, I guess, because yeah, it just makes you feel not alone. And during, especially being recently diagnosed, and you're asking, why me? Why did this happen to me? What did I do wrong? Having those different connections of like, okay, well, there is actually a large subset of individuals across the world that are going through this exact same thing. So maybe it's not as rare as we think. And then it kind of gives you that level of you're not alone.
Yeah. Yeah, I think that's really helpful to hear. And one thing that we don't do as well, I would say, in the treatment community, like providers, is fostering that, I'll say community, but we're so busy on our side and we're so focused on the treatment, understanding the disease, getting the staging, making sure we deliver really good care. And there's a lot to do in a short amount of time when someone's diagnosed. We do not do a good job of making sure, I struggle, I'd say, of making sure that people are navigating it, and supported while they navigate it. It's very
Yep.
common for us to see patients come in with friends, family, other patient advocates. Is a term for those listening that I would look into. Patient advocacy groups in your disease type. And because this is a total black box for most people,
Mm-hmm.
and understanding what's going to happen is a really important part of feeling in control. Because when people are diagnosed, a lot of people, that is, a diagnosis of cancer is synonymous with loss of control.
Mm-hmm.
And to a certain extent, that's true. But it's not true in all elements. So I would strongly recommend trying to take control of the things you can control, and understanding the disease, understanding treatment options, discussing this with the broader community is, I think, a great way to take back some of that control and really buckle into the driver's seat, because you're the one that's got to live through it, and
Absolutely.
you're the one that makes all the critical decisions. We're here to help
Yeah,
you.
and I was very fortunate where in my younger lung group, um, I knew which NCI hospital I was going to be going to when we moved to Utah. And I said, hey, is there anyone who's being treated here? And a couple individuals responded. And they're some of my closest friends now, because I see them at the hospital, I see them at the infusion center. We talk all the time. We bounce ideas off of each other, and they don't have the same mutation as me, but one individual happens to see the same oncologist that I do. And so we would never have been introduced otherwise. And, we live in the same town, and, due to patient confidentiality, they just, our care teams can't share, oh, you need to get in touch with XYZ person. Yeah, I'm a massive proponent of being part of those groups to make you feel less alone. And you will learn so much from them. You will learn, even though none of them are necessarily doctors, you'll learn a lot more about your cancer, which is very helpful as well. The more information, sometimes the better. Not all the time, but it's just good to have that education behind you.
Well, and to your point, these organizations are often throughout the United States and broader.
Mm-hmm.
And as a provider, I am very biased by practices in my community,
Mm-hmm.
and I'm biased by the clinical trials that we may have, to say I don't know about all the other ones, or I don't know how promising they might be, because there's a lot of earlier phase trials, and we'll talk more about trials at a different podcast. But for a patient going through something, particularly something rare, the other patients in that community, the collective knowledge is going to be really, really strong.
Yep.
So I think that is something that you can actually bring to your oncologist and say, hey, at XYZ centers, they have these trials and the patients on them say they're doing well. What do you think? Like, that is incredibly valuable.
Yep.
But okay, I think we're probably at a good stopping point today.
Yep.
Any last words, Samantha? Or...
Nope, this has been great. I've learned a lot myself.
No, likewise. Thank you, everybody, for listening. As always, feel free to like, subscribe to support cancer research, and visit crackingcancer.org for any questions, to get involved, or to donate. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research, because together we can crack cancer.